Après 42 jours de surveillance, sans cas confirmé,
After 42 days without a confirmed case of Ebola, and as directed by the international health regulation, I declare this day, 18 January 2015, the end of the Ebola outbreak in Mali. Now, travelers to and from Mali should not be submitted to any health checks abroad.
ne doivent plus faire l'objet de traitements particuliers à l'étranger.
Ce jour 10 janvier 2015.
Today, January 18, 2015, is a historic day for the fight against the Ebola virus disease outbreak in Mali, Africa, and the world. It's therefore a pleasure, an honor, and pride on behalf of the World Health Organization to declare Mali Ebola-free. While enjoying these exceptional results, I would, however, like to remind us all that we have won battles, but the war against Ebola virus disease continues. As all affected West African countries will not be declared Ebola-free, we will continue the fight with the same level of commitment.
Mali officially announced the end of the Ebola virus disease outbreak on the 18th of January, 42 days after the last case tested negative in the laboratory. The Ebola outbreak was the first that Mali has ever experienced. According to the World Health Organization, 6 out of the 8 cases reported in Mali died. The diagnosis of the first case was made on the 23rd of October 2014 in K and came to Guinea through Bamako, the Malian capital. A rapid response plan was revised and adopted to prevent a possible outbreak in Mali following the announcement of the Ebola epidemic in neighboring Guinea.
Mali a commencé la lutte contre Ebola, en tout cas les travaux de
Mali started the fight against Ebola, at least in terms of preparedness, alert and strengthening disease surveillance the day before the official declaration of the epidemic in Guinea on 21-22 March 2014. Since that day, we began preparations in the field and in Bamako. Preparedness activities were concentrated on strengthening entry points, the border with countries exposed to the epidemic, to ensure that teams posted there are strengthened by increasing the number of personnel and logistics. We intensified our relations and shared information with these countries. Since then, we began training and strengthening of staff.
Health facilities deployed the resources to fight the outbreak of Ebola virus disease. Among these include Gabriel Touré and K Hospital, which diagnosed the first case of Ebola.
On October 21st, 2014, around 21 hours, the medical team at work was able to identify a suspect Ebola case. Immediately after, we informed the regional and national authorities about the situation, the suspect case, and the health workers who were in contact with him were isolated.
We took important steps to prevent the spread of Ebola, such as providing hand-washing facilities, taking body temperature at entry points of the hospital, and reducing the number of entry points.
The Sarajevo Laboratory, Research, and Training Center on TB and HIV/AIDS also played a leading role in the diagnosis of Ebola cases.
Nous avons une équipe bien formée qui est sur place.
We have a well-trained team on site. The material is there, the skills are there, and all the tests that were made here at Sarajevo were reviewed in Atlanta. The results matched 100%, which reassures us that the skills are there.
Aujourd'hui, Sarajevo est capable
Sarajevo is capable of producing a result in 5 to 6 hours, which saves a lot of time. Imagine if the samples were to go to another laboratory abroad. It would take days. Meanwhile, human lives would be in danger and it would be very difficult to identify the contacts which could further spread the disease.
The Ebola virus disease outbreak mobilized all sectors of Malian society and partners. the pooling of skills and expertise of national, regional, and international partners within the Ebola Response Coordination Group has been key determining factors in the elimination of the outbreak. This group includes the Emergency Operations Center and partners.
WHO is by definition the leading health partner. We work closely with Doctors Without Borders for the treatment of patients in the Ebola Treatment Center and with CDC for contact tracing. Contact tracing helps break the chain of transmission. We also work for technical communication and social mobilization with UNICEF to help the population understand what is the disease, how to prevent it, and what precautions are to be observed to prevent the infection. We also worked with all partners, whether those of the United Nations systems, those of bilateral and international cooperation, NGOs practicing in Mali, and the civil society.
On a mis un ensemble de mesures.
We implemented a series of social practices to help manage the outbreak of Ebola in order to have the greatest impact in Mali. With this, I would like to stress that the success of these interventions were only possible through our extensive work with other organizations, as well as religious, community, and family leaders.
We have a strategy that is based on community dialogue and interpersonal communication, including at household level. Communication officers use it when they exchange with the community. They ask questions to which the community answers. Once the community understands the challenges related to the issue, behavior change follows automatically. Communities are keen to receiving information and messages for prevention purposes. The procedure is then monitored through a good monitoring system.
Mali and its partners mobilized additional resources to strengthen health control at the borders and within health facilities, as well as the capacities of the Rapid Response Team of the Emergency Operations Center.
L'équipe d'intervention rapide, c'est une équipe qui intervient.
The Rapid Response Team is a team that works in the field when there is information or suspect cases. The response team receives phone calls, goes in the field to investigate, and, if needed, takes samples and transfers the suspect cases to the treatment center.
Once we're on the ground, we must first and foremost try to raise people's awareness and sensitize and make them understand the severity of the disease so that they accept that we go near patients, take samples, and bring the patient to a treatment center. Sensitizing people takes time because sometimes people refuse us to go near patients or take the sick to a treatment center.
The most important thing about this center is that it's divided into two areas. One is a low-risk area where the medical team wears surgery equipment, boots and gloves. The other one is a high-risk area where Ebola cases are isolated.
Si on veut arrêter la chaîne de transmission,
If we want to stop the transmission chain, we must be very strict and we must not allow any laxity, any complacency. Each case should be treated properly, thoroughly.
comme si vous aviez affaire à un malade avéré.
Le groupe de suivi contact est l'élément le plus capital dans la gestion de Ebola.
Contact tracing is a key component for the management of Ebola. Contact tracing helps identify contacts that can become suspect cases. Following the identification phase, we provide support to prevent the spread of the outbreak. This consists of identifying the suspect cases, the people they had contacts with, within or outside their families, and who are the people who transported them. Then we trace their contacts during 21 days.
When it comes to contact tracing, the contacts monitoring team informs us that a contact has become symptomatic, and automatically we deploy the rapid response team on the ground so that we can immediately transfer the case to the Ebola treatment center. This decision making is done in this room.
Le centre, de façon convaincante, en tout cas, a joué un rôle dans la gestion des rumeurs.
The center played a major role in terms of rumors management. The alarm unit has been a breeding ground for rumors because those who were aware of the existence of the center called to get information. The center recorded more than 20,000 phone calls, which were analyzed. We, communicators, analyzed the rumors, including the wildest one, in order to refocus the messages we had developed. This is extremely important because rumors are more deadly than the disease itself.
La rumeur est plus mortelle même que la maladie.
Families exposed to Ebola made tremendous efforts against the Ebola outbreak.
My child was a health worker. The Ebola disease has taken him from us. God made this happen. My son was infected whilst he was treating a patient who came from Guinea. We, who are his family and our friends, didn't give up. We took care of him until he died.
Quand sa fiancée est tombée malade, et puis elle fait la fièvre, bon, elle a vomi une seule fois.
When Salif's fiancée became ill, she had fever and was vomiting. I told Salif's father to take her to the hospital for a medical checkup, and we found out that she was infected by Ebola. She was hospitalized and received treatment at the Ebola treatment center. I phoned her every morning and every evening to talk to her, to tell her that she will be okay, to take her medication, and to eat well. Thank God, after a few weeks, she was cured.
Pendant à peu près quelques semaines, elle a été guérie.
Cette famille-là a été exemplaire. Exemplaire sur la gestion de la maladie.
This family is a model in terms of disease management and risk management. This family was able to help people in the best way one could imagine and to provide moral support. Moral support is extremely important. Good nutrition also helps tremendously.
Se nourrir, ça aide beaucoup.
C'est l'acceptation du travail par les familles qui a été.
The acceptance of the work by the families was the key to success. As we say here in Mali, the constraint does not help to succeed. Families have voluntarily adhered to the movement to do what needed to be done. That was the key to success.
Religious communities played a major role in the fight against the Ebola outbreak. For instance, during the Maulud, religious leaders were called upon to raise awareness about prevention of the disease and draw attention to the facilities that were put in place for hand washing and taking temperatures. This festival attracts large gatherings of people, of which were more than 150,000 people in major stadiums of Bamako.
Dès le départ, dès Since
the first cases were confirmed in Bamako, we started raising public awareness in mosques and Islamic associations, not only in Bamako, but in all regions as well. We also draw the attention of the faithful on the importance of hand washing once they go back home and before they start doing anything. So, the awareness campaign has helped a lot.
In Mali, the training of health workers were one of the major activities in the fight against the Ebola virus disease. More than 900 health workers were trained in the areas of epidemiological surveillance, case management, and disease prevention and control.
La stratégie adoptée par l'OMS a été d'abord de faire la formation des formateurs.
The strategy adopted by the World Health Organization is based on training of trainers. A total of 108 social and health workers, doctors, senior health technicians, such as nurses, midwives, anesthetists, were trained. They come from all regions of Mali. We initiated the training in hospitals. We trained the trainers so that they could, once trained, conduct training sessions.
Être utilisé pour organiser des formations.
There is a big difference between the training sessions. We've learned new things today, such as the wearing and the removal of personal protective equipment, including gloves.
Nous avons appris comment est-ce que la maladie Ebola évolue. Ensuite, nous avons appris
we learned how the disease evolved. We also learned how to behave, how to prevent the disease, how to clean the places where patients are admitted. Finally, we also learned how to wash our hands with bleach. We have seen that there is a difference between what we are doing and what we have learned today. So what we learned today will greatly enhance our performance.
Besides this workshop, other trainings were organized for the staff of the Emergency Operations Center in the areas of information management and mapping, as well as for journalists.
La cartographie aujourd'hui est devenue un outil indispensable.
Mapping has become an essential tool. It helps actors who are on the ground to identify one another and what each and everyone is doing. There are about 30 international organizations on the ground, including those of the United Nations. It is important that we know what each and everyone is doing so that we can combine our efforts for a greater impact of the Ebola response.
Mapping is able to provide a very concise and condensed and clear picture on, for example, a single page about what is going on at the moment in terms of the response. So you can have reports, you can have spreadsheets, you can have data, but if you want to be able to assimilate that information, you have to work your way through all that. What mapping is able to do is, for example, to provide a dashboard, if you like, which shows perhaps region by region or cercle by cercle in the case of Mali, where things are happening. So we can use mapping as a means of communicating in a way that most people understand.
The simulation is primarily intended to validate the operating procedures that we have proposed. We also discuss about the different phases of the crisis. The ultimate goal consists of writing a sequence of operations that the intervention teams will use as information and data source once they are on the field. We are aware that, despite the declaration made on January 18 on the end of the epidemic, the crisis is not yet over. In addition, the Emergency Operations Center has the ambition to be used for other health crises. We must remain vigilant.
Many factors have contributed to stopping the Ebola virus disease in Mali. These included the rapid response by national authorities and partners, the effective coordination of the response, the leadership of the head of state, and community involvement.
Aujourd'hui, vous partez dans les villages les plus reculés du Mali, vous demandez aux élèves également.
When you go in the most remote villages in Mali, you ask students questions about Ebola. You realize they are informed about Ebola. We are not only talking about one single department, but about administration at national, provincial, and district level. Local Ebola committees meet every day and exchange information on Ebola.
We met some families and women's groups to talk about stigma. We saw some Ebola cases and we spoke about them. People spoke and exchanged ideas. The people who didn't understand the issue at the beginning of the sessions end up with a better understanding of it. From that moment, they started changing their behavior.
Ce qui nous a aidé à réussir, c'est l'engagement, la détermination de l'ensemble de la population.
The commitment and the determination of the entire population was the key to success. Let me put it this way. In other contexts, misunderstanding arising from the weak adherence of the population would have been an obstacle to the success of the struggle. In the case of Mali, I can say that we have not experienced this difficulty because the population rose as one man. The collaboration of the United Nations agencies and of all technical, financial, bilateral, and multilateral partners was also decisive. We cannot say that money has been a decisive factor. We had some financial resources, but no comparison with other contexts that had far greater resources. We especially acknowledge the determination at all levels.
Other decisive factors of the elimination of the Ebola outbreak in Mali included promoting communication for behavioral change, creating media interest, stopping transmission channels, and engaging socio-anthropologists for support in communities.
Tous les jours, le centre des opérations d'urgence se réunissait.
Every day, the Emergency Operations Center met and discussed with all partners on the evolvement of the situation. The coordination and regulation team was on site 24 hours a day to manage alerts and was communicating with the various call centers and health facilities to answer to phone calls on the green and blue numbers, respectively.
Nous avons renforcé la coordination pour nous assurer que tout le monde travaille.
We strengthened coordination and ensured that everyone is working on a single national plan. UNMIR and WHO support was crucial in terms of identification and mobilization of resources for the UN system, the bilateral and multilateral partners, only to name a few. In terms of logistics, at the UN level, we could travel with the aircrafts of the United Nations mission in Mali. And when the first case was diagnosed in K, the teams were deployed in 40 minutes compared to 8 hours if they had traveled by road. We work with IOM to strengthen health control at the borders. We work with OSHA, UNDAC to strengthen the emergency procedures. We are also supporting Mali to update the response plan as we are moving towards a more dynamic phase because the Ebola risk is still raging in Guinea.
A battle is won. However, the fight against Ebola is far from over, as the epidemic is still occurring in neighboring Guinea, in Liberia and Sierra Leone, it may resurface in Mali.
The disease is still raging in other countries. Therefore, it can reemerge here. We must continue to comply with health regulations to ensure that Ebola is no longer with us.
We need to improve prevention. We must increase the number of people who are working at the borders. We must strengthen prevention in the different health facilities and continue to train and educate the personnel who are working in hospitals, referral and community health centers.
I appeal to the medical staff, among which they are researchers. I ask them to sacrifice their lives to do research.
Epidemiological surveillance throughout the country, including at the border of Guinea, is a top priority for Mali and its partners.
The measures put in place during the outbreak must be strengthened. We are moving into a new preparedness phase, an intensive preparedness phase that should be implemented in the context of health system strengthening. I would like to congratulate the Malian government and its partners for revising the contingency plan and the response plan, which has now become a plan aimed at strengthening the health system and putting in place priority preparedness measures to prevent importation of Ebola cases.
Although Mali has been declared Ebola-free, we should maintain health control measures as the epidemic is still raging in neighboring Guinea. If we lower the guard, Ebola will re-emerge. We must avoid this. We must avoid more cases and deaths. We must also avoid more spending, because when a person becomes ill, the health system that unfolds around them is extremely expensive. So I think that we would gain much if the disease doesn't re-emerge. We must also work hand in hand with our colleagues from Guinea to ensure that the disease also disappears on their side.
We can only monitor the situation at our borders through surveillance and through contact tracing if there are Ebola cases. Although monitoring is key, we must strengthen communications as well. We must also strengthen disease control in hospitals and health centers. Last but not least, community involvement is key if you want to succeed.
The development of a vaccine is crucial to stop the Ebola virus transmission chain. Mali was the first country where CH83 vaccine was tested.
On a été le premier pays à faire le premier vaccin monovalent Ebola.
Mali was the first country to test the first monovalent Ebola vaccine, along with the National Institute of Health in the United States and Oxford University in England. In Mali, 91 health workers from this country have been vaccinated. The goal was to evaluate the safety of the vaccine. I myself have received the vaccine. Thank God, I haven't had any problems so far. Of the 91 health workers who were vaccinated, thank God we haven't had the slightest problem either.
Regarding the perspectives, we plan to undertake a phase 2 trial with the same vaccine. And if God gives us luck and a long life, we will make another phase 1 trial with a bivalent vaccine. The one we tested is a monovalent vaccine, so we would like to do another trial with a bivalent vaccine to see what will best help the people.